Clogged arteries often don't show symptoms until they're severely narrowed or blocked. That's why it's crucial to recognize the subtle signs your body might be sending you. Chest pain or angina. That squeezing sensation in your chest isn't something to brush off. Chest pain, also known as angina, is often the first red flag of clogged arteries. It happens when your heart muscle isn't getting enough oxygen-rich blood due to narrowed coronary arteries. This discomfort can feel like pressure, squeezing, fullness, or pain in your chest. It might even radiate to your arms, neck, jaw, or back. The pain typically occurs during physical activity or emotional stress and eases with rest. Don't ignore it. Angina is your heart's way of saying it's struggling. If you experience these symptoms, especially if they're new or worsening, it's crucial to seek medical attention promptly. Shortness of breath. Finding yourself winded after climbing a flight of stairs that never bothered you before. Shortness of breath could be your lungs crying out for help due to clogged arteries. When your heart can't pump blood efficiently because of blocked arteries, it can lead to a buildup of fluid in your lungs. This makes it harder to breathe, especially during physical activities. You might notice you're panting more than usual or struggling to catch your breath, even with minimal exertion. It's not just about being out of shape. Persistent breathlessness, especially when it's a new symptom, could be a sign that your heart is working overtime to compensate for clogged arteries. You should talk to your doctor about these changes in your breathing patterns. Fatigue and weakness. Feeling constantly drained, even after a good night's sleep? Unexplained fatigue and weakness could be more than just a sign of a busy lifestyle. It might be your body's way of telling you that your arteries are clogged. When arteries are narrowed, your heart has to work harder to pump blood throughout your body. This extra effort can leave you feeling exhausted and weak, even after simple tasks. You might notice a significant drop in your energy levels, struggle to complete daily activities, or feel the need to rest more often. If this fatigue is persistent and seems out of proportion to your activity level, it's worth discussing with your healthcare provider. Remember, your body whispers before it screams. Listening to these subtle signs could be crucial for your heart health. Numbness or coldness in extremities. Numbness or coldness in your extremities might be more than just poor circulation. It could be a sign of clogged arteries. When arteries become narrowed due to plaque buildup, blood flow to your limbs can be restricted. This reduced blood supply can lead to a sensation of coldness, particularly in your hands and feet. You might also experience numbness, tingling, or a pins and needles feeling. These symptoms often occur even in warm environments and can be accompanied by a change in skin color. If you notice persistent coldness or numbness in your extremities, especially if it's asymmetrical or accompanied by pain, it's time to check in with your doctor. High blood pressure. High blood pressure, or hypertension, is dangerous because it typically has no symptoms. However, it's a major red flag for clogged arteries. As arteries narrow due to plaque buildup, your heart has to pump harder to push blood through these constricted passages. This increased effort leads to higher pressure in your blood vessels. Regular blood pressure checks are crucial, as hypertension can damage your arteries further, creating a vicious cycle. If you consistently see numbers above 130/80 mmHg, it's time to take action. Lifestyle changes, medication, or a combination of both can help manage high blood pressure and protect your arteries from further damage. Don't let this silent threat go unnoticed. Keep tabs on your numbers, and your heart will thank you. The irregular heartbeat. An irregular heartbeat, or arrhythmia, can be a sign of clogged arteries. When arteries are narrowed, it can disrupt the normal flow of blood to the heart, causing it to beat erratically. You might experience palpitations, feeling like your heart is racing, skipping beats, or fluttering. Some people describe it as a flip-flopping sensation in their chest. While occasional irregular heartbeats can be harmless, persistent arrhythmias could indicate underlying heart problems, including clogged arteries. If you notice frequent or prolonged episodes of irregular heartbeat, especially if accompanied by dizziness or shortness of breath, it's crucial to consult your doctor. Your heart's rhythm could be the key to uncovering hidden arterial issues. Jaw pain or neck discomfort. That nagging ache in your jaw or neck might be more than just tension. It could be a surprising sign of clogged arteries. When heart arteries are blocked, pain can radiate to the jaw, throat, or neck. This discomfort is often described as a dull, burning, or pressing sensation that can come and go. It might worsen with physical activity or stress and ease with rest. What makes this symptom tricky is that it's easy to mistake for other issues like dental problems or muscle strain. If you experience persistent or recurrent jaw or neck pain, especially if it's accompanied by other cardiovascular symptoms, don't brush it off. Consult your healthcare provider to rule out arterial issues. ED in men. Gentlemen, this one's for you. ED isn't just a bedroom buzzkill, it could be a warning sign of clogged arteries. Here's the thing, achieving and maintaining stimulation requires healthy blood flow. When arteries are narrowed due to plaque buildup, it can restrict blood flow to all parts of the body. While ED can have various causes, it's often one of the earliest signs of arterial problems. In fact, some experts consider it a predictor of heart disease. If you're experiencing persistent difficulties with stimulation, it's worth having a frank discussion with your doctor. It could be crucial for your overall cardiovascular health. Leg pain or cramping while walking. Leg pain or cramping while walking, also known as claudication, could be a sign that your arteries are clogged. This condition occurs when there's not enough blood flow to your leg muscles during exercise. You might feel aching, cramping, or fatigue in your hips, thighs, or calves that starts when you walk and stops when you rest. It's like your legs are saying, "Hey, we're not getting enough oxygen down here." This pain is often predictable, occurring after walking a certain distance. If you notice these symptoms, especially if they're getting worse over time, it's important to talk to your doctor. It could be your body's way of signaling a need for arterial attention. Dizziness or lightheadedness. While dizziness can have many causes, persistent lightheadedness could be a sign of clogged arteries. When arteries are narrowed, it can reduce blood flow to your brain, leading to feelings of dizziness or lightheadedness. You might experience a sensation of spinning, unsteadiness, or feeling faint, especially when standing up quickly or during physical activity. These symptoms can be particularly concerning if they occur frequently or are accompanied by other signs of heart problems. Lightheadedness can also be a sign of an irregular heartbeat, which, as we discussed earlier, can be linked to clogged arteries. If you find yourself frequently reaching for support due to dizziness, it's time to reach out to your doctor. Your balance issues might be tipping you off to an important health concern.